Welcome everyone to Gladney University. My name is Nancy Robbins and I'm the Director of Digital Media. We're going to get started at 1. We're just waiting a few more seconds for everyone to log on. We have a really exciting opportunity and training for you guys today, so I can't wait to share this with you. So just get comfortable, make sure your audio is working, and I will start in just a minute. Okay, so let's get started. Hello and welcome to Gladney University. Today we are so excited to bring some of the Heart and Harmony team here to train us. And I am super excited to hear about music therapy and childbirth. But first I want to go over some housekeeping tips with you. One, on your GoToWebinar panel should be over maybe on the right hand side. You're going to see a little tab called handouts, and if you'll click on that, you'll be able to download the training presentation. So you can go ahead and do that now. Also, if you have any questions throughout the training, please go ahead and put that in chat, and Jess Alvarez and myself will respond to those, and we'll also hold those questions for our presenters when they come to a stopping point or at the end of their presentation. If you are requesting a certificate of completion or wanting CEUs for social work or counseling, we can provide those for you. We just ask that you complete the CEU evaluation that's going to pop up when the webinar is over. So don't leave your screen. When I click end the webinar, another screen's going to pop up and it's going to bring you to that evaluation. We will send those certificates out within 7 business days of today so that you will have those. And we are really excited to be able to provide those for you. We hope that if this is your first Gladney University training, that you will come and join us for others. We have a lot of trainings this month in October. We're kind of doing a women's health month. And so we have a lot of fantastic trainings that we hope that you will be interested in joining us on. So without further ado, let me introduce you all to Annie Roberson and Sammy Graham from Heart and Harmony. And let me just share with you, as they're coming online right now with their webcams, how fortunate we are to have them here. They came earlier this year to Gladney University to do a training for us, and I just was enthralled with music therapy. I had never heard of music therapy before, and I love music. So them just presenting that touched my heart. And then we had them on the Reframed podcast that the Gladney Center for Adoption has and produces, and they are just a joy and so full of knowledge. And I do believe that music can heal and change people's lives. And so I am absolutely thrilled to welcome Annie Roberson and Sammy Graham, and they're going to introduce themselves now. So Annie, let me turn it over to you, and I pass the baton to you and make you the presenter, and you now have control. So welcome. And I think you're muted.
Awesome. Thank you so much, Nancy. We're really excited to be here today. Like Nancy said, oh, how's that? Can we see that? Perfect. Yes, like Nancy said, my name is Annie Roberson. I'm really glad to be here with you guys today. I'm a music therapist from Heart and Harmony Music Therapy, and I'm presenting today with my colleague and coworker and wonderful human being, Sammy. Let's see, so I'll let Sammy get logged on here, and we'll say a little bit about ourselves. So like I said, my name is Annie Roberson. I grew up in Nashville, Tennessee, graduated from the University of Alabama, and interned here in Fort Worth with Heart and Harmony Music Therapy in 2018. I'm a board certified music therapist, and I serve people from all ages and diagnoses, and use music to help people reach their therapeutic goals. And I'll let Sammy say a little bit about herself as well.
I'm not sure that my webcam's on yet, but can you hear me?
Yes, I can hear you.
Okay, great. So yeah, my name is Sammy Graham. I interned with Heart and Harmony in 2017. And I joined the team right after that. So I've been working for Heart and Harmony since that time, graduated from Sam Houston at the same time, 2017. And let me tell you a little bit about our team. Heart and Harmony is a Fort Worth-based private practice. There I am. Yep, we're a Heart and Harmony. We are a music therapy private practice based out of Fort Worth, and we serve clients all over the DFW Metroplex. Currently on our team, we have 9 music therapists and 3 interns. We really love training interns. It's I think a passion of a lot of people on the team. And so most of our clients we see in home, we mostly do home health for individuals with disabilities, but we also have different contracts like mental health hospitals, drug rehabilitation facilities, neuro rehabilitation centers. So we're really working all over. I'm going to go ahead and get into a little bit about what music therapy is. I know we might have some repeat people from the last time we were here, and that's great. A lot of people haven't heard of music therapy, so we're going to kind of take some time to go over that for those of you who may not be familiar, and then we're going to really dig into music therapy and childbirth and postpartum and all of that. So music therapy does have a specific required training. You need to finish a 4-year bachelor's degree or a master's equivalency. You complete a 6-month internship, and you sit for the board certification exam, and we have to do continuing education, things like that. So music therapy is a newer field. I think that's why a lot of people haven't heard of it. Really got its start in the 1950s, post-World War II. A lot of musicians were playing music for veterans since we had this huge influx of veterans, and people were really noticing the effect that even just that passive music experience, the positive effect that had on those people. So that's really when music therapy started to become established as a practice. So that's when a lot of research started happening, collegiate programs started happening, training and all of that. So what is music therapy though? The short answer I give is that music is our tool to work on non-musical goals. So while it may look like a music lesson, sometimes in music therapy, like say we're working on guitar with a client, we're actually focusing on maybe finger dexterity or their ability to track and use their selective attention or their divided attention to look back and forth. So we're working toward non-musical goals. That's why it's different than music lessons. It is an evidence-based practice. That's really, really important to know, especially advocating for it out in the community. So we do use the most current research. We have 2 music therapy journals, although sometimes music therapy research is published in other journals. We do follow the scientific method in our research, and our journals are peer-reviewed. So it is really important to know that this is evidence-based. And one of the most profound things about music therapy, and kind of just speaks for its power as a whole, is that music has a really, really far-reaching effect on our brain. So music isn't processed in one single section of the brain, it is processed in every major part of the brain. So that's why we're able to work on so much with music, and that's why it works. It activates all those good spots in the brain.
Absolutely. So like Sammy said, music is processed in every part of the brain. And that's one reason why music is so effective with people of all ages, with all kinds of diagnoses. So one thing that music plays a really vital role in is this concept of neuroplasticity. So if you're not familiar with neuroplasticity, this is the ability of the brain to form and reorganize synaptic connections even after that critical period of brain growth and development that ends around age 3. So we typically think that once you've got at age 3, like that's your brain, that's what you've got for the rest of your life. But the process of neuroplasticity is taking place all throughout your lifespan. And because music is processed in all different parts of the brain, it's a really big factor in enhancing the process of neuroplasticity. So when neuroplasticity is taking place, when changes are happening in the brain, one thing that happens is new neural connections. So neurons that weren't previously connected together can fire together, can bind together. Another thing that can happen is the reorganization of existing neural networks, and as well as brain remapping. So you may have seen this with folks that have experienced brain injuries, maybe strokes, things like that, that have an injury in the part of their brain that allows them to process speech. Well, because music can be processed in all areas of the brain, we can use music as a tool to rewire and remap the brain so that speech can be processed in different areas of the brain than it would normally be, totally reformatting how your brain works. So how specifically does music affect neuroplasticity? One way is that music increases dopamine production. So dopamine is what we call kind of the happy chemical. It's what not only makes you feel happy, but also it facilitates the formation of new neural connections. Music is also involved in the synchrony of neural firing. So we like to say that neurons that fire together wire together. So if you pair a new neural connection with a music stimuli, you're able to build that connection that way and use music at first to cue, to build the skill, but then to bring the music back and allow just the new skill to take place altogether. And music is also very important in the production of clear signals. So noise, as I'm sure lots of us know, stresses you out, but it also noise actually creates cortisol in your brain. That's your stress hormone. And cortisol prevents new neural connections from happening. So not only when there's music to drown out maybe environmental noise in the background, but particularly when using music to give cues, commands, that kind of thing, sung text can actually be processed more easily in the brain than spoken text can.
Yeah, so when we're talking about music having an effect on every major part of the brain, that means that we can, as music therapists, affect all of these major areas in our human functioning. So as music therapists, we break it down to these 5 domains of human functioning. So I am going to just briefly touch on each, just to give you an idea of the implications of music therapy for all of these different areas. So music's effect on motor functioning, really interesting stuff. A really important concept to know though, and this will really apply to a lot of what we're talking about later, having to do with childbirth, is the concept of entrainment. So if you're ever walking and you either have earbuds in or you're in the grocery store and there's music on, most people have a tendency to walk in time with that music just without even realizing it. We just do that. And that's entrainment. So our bodies are very inherently musical. We have a rhythmic heartbeat. We have a rhythmic breathing rate when they're healthy, right? And are walking even. So this concept of entrainment can really apply in a lot of different ways. It can apply to our gait, our walking. It can apply to our breathing rate and our heart rate. It can also apply to our emotional state and things like that. So when we're talking about music therapy motor functioning, we're oftentimes entraining to different elements of the music. It might be rhythm. We might be entraining in different ways too. So music therapists, just a few examples of some of the stuff we do with motor movement. Sometimes we may be working on gross motor movement. Maybe somebody is in physical rehab and they have an exercise where they have to do this motion over and over and over. That might be a little bit tiring, might be boring, might be painful. So the music therapist can come in and give them a drumstick and they can play a favorite song with them while they do their exercise, but they're getting the auditory feedback and they're having fun. It's really good. It's a really great distraction. It's a really good stress relief, and it's really good motivation too. Sometimes therapy can feel like work. All right, so music's effect on cognitive functioning. Yep, we're talking about things like attention and memory and learning. If you think about when kids are learning, when we learned in kindergarten and pre-K, it's all through music. That's because it's easier to commit it to memory. You're getting that dopamine, it's facilitating neuroplasticity, right? Like we all still sing the alphabet song to alphabetize things. Well, I shouldn't speak for everyone, I know I do. But that's because music is really, really great for learning, pairing concepts with that musical stimuli. So a lot of times in music therapy, we'll play music-based games to help work on things like memory and attention. A lot of times, like I said, it can look like music lessons because we'll be working on piano, but really what we're working on is them in their divided attention of going back and forth between tracking and playing the keys. Things like that. So communication, music therapy and communication. So this is not just verbal, this is nonverbal communication too. We communicate a lot nonverbally. It's important to know that. So a lot of times people say music is a universal language, and I think that that's true and not true. I would say it's a universal language in the sense that we all use it to communicate, but it doesn't necessarily mean the same thing to everyone else. Music is so personal, and it's important to know that going into communication type stuff, but we can look at it on a really concrete level. And I think Annie touched on this a little bit with rewiring the brain to work on speech and things like that. So yeah, I'm going to save that. I have another thing to say, but I'm going to save it for later when we talk about childbirth. All right, so the social domain. We're working on things like social skills and self-awareness and focus. Again, music is really motivating. It's a good distraction. So I find sometimes that with my groups in the psych hospital, I get comments afterward like, hey, so-and-so has never talked in a group before, but they did in your group today. And it's because, you know, they got to talk about music, and we got to kind of work on processing things and being in the moment and being self-aware in a less threatening way. So a lot of times when we're working on social skills, again, we might do kind of group games. That's helping on working things like sharing and nonverbal communication like eye contact, or we might do things like group improvisation, to where you really are having to communicate with others in the group to make this experience successful. Yeah, I'm going to talk about emotions. Yes. So I think this is probably the first thing we all think of when we think of music's effect on us as humans, because we kind of do this with ourselves instinctively. We use music to validate our emotions. We use music to express our emotions. Important thing to know about music therapy and the effect on our emotional state is this concept of the ISO principle. So music therapists use this technique a lot of the time to help client get to a more relaxed, stable, calm state, whatever the desired state is. So for example, if someone in the hospital is experiencing a lot of discomfort, possibly anxiety, possibly pain, a music therapist can come in with live music and play the music in such a way that sort of meets them where they're at as far as their intensity level at the time. So if you were to come in and just play You Are My Sunshine for somebody who's in pain and really anxious, it might not be well received. If that song is really important to them and really special, maybe, but for me, I'd be a little ticked off because that's not really validating to my current state, right? So as a music therapist, we can come in and meet them where they're at and have them feel heard through the music, and then systematically alter that music to be more calm, to get them where they're at. And because of the concept of entrainment, they're going to naturally be entraining their breathing rate to the music as we're altering it. So we're making it slower, which is in turn going to lower their heart rate, hopefully lower that cortisol rate. It's pretty remarkable. And again, this technique could be just over the course of one single song, or it could be like an hour-long type thing, depending on the client and their need. So this is really, really cool. And we'll definitely talk about that more when we get into childbirth. And I think this is still me, Annie, am I right? You're frozen, I think it's me.
Yes, you are correct.
Yeah, cool. Okay. So yeah, let's talk about pregnancy, childbirth, and postpartum music therapy. So again, we're an evidence-based practice, so it's important to talk about what the research says. These are just some of the effects that music therapy can have on women during labor, and it's pretty remarkable. Emotional support, obviously, we all use music for emotional support. It can promote family bonding immediately postpartum and during pregnancy as well. Creates a calm environment, that's important. We'll talk more about that. Again, like we just talked about in training with the breathing, efficient breathing improves focus, helps to reduce pain and discomfort. It's empowering. That's really important to know. So in labor, it's common, I think, for the mother to feel out of control of the situation. Things are just happening. And if we can help them to bring in music that is preferred for them and empowering and loving and kind, that's really going to give them a big sense of courage during that time. So that's really important. Helps to reduce anxiety and induce a relaxed state, relaxed heart rate, and improves ability to manage stress. Yeah. So what we follow here at Heart and Harmony, I think we currently have 3 therapists on our team trained in this method. We use the sound birthing method, and this is the only method for music therapy and child labor right now. It's created by Mary DiCamillo. And this method uses carefully designed music programs or playlists to help with that empowerment and the calm and everything through birth, right? So we're going to get a little bit into more of the specifics of how those playlists are crafted and where they go for the different stages of labor. But first, I want to talk a little bit about some more research just so you can see how profound effect this can have. So this is a case study done by Dr. DiCamillo, who created the method, and she was doing music therapy assisted childbirth with a mother who did not have hypertension before the pregnancy. So this happened later on in the pregnancy, all of a sudden out of the blue. She had a pretty severe pregnancy-induced hypertension to the point where they had to go to the hospital. So this was not anywhere near her due date, but husband called Dr. DiCamillo and said, we need you here, like it is happening. They're saying this is going to happen. So the mother really, really, really wanted to have an unmedicated vaginal birth. That was her wish. And doctors were saying, with your blood pressure the way it is, if it's not down by this time, we're going to have to go in for a C-section. So Dr. DiCamillo came in, and again, very similar to the ISO principle like we just talked about, she came in and met the mother where she's at, and over the course of maybe a couple hours played music to get the mother more calm, and it was successful. The mother was able to calm her heart rate and anxiety enough where her blood pressure went down to where the doctor said, okay, this is safe, this is okay, you can use the music as your pain relief during this birth and have the birth that you choose. And the baby turned out okay as well. So again, this is a case study, so this is like a pretty special moment, but that really does just show that the very concrete effect that music can have for people during this time. So when we're talking about childbirth and mother having an experience that feels safe and meets their desires, a lot of times what we're talking about is undisturbed birth. So for the mother to have a birth that feels safe, we need to create that environment, and we can really help to do that as music therapists. So what we're hoping for during childbirth is that the mother feels private, safe, and unobserved, and free to follow her instincts, to be in tune with her body, so that she can feel calm. So we're just going to talk a little bit about how music can help with that. So creating a sense of privacy, this is really important because the hospital isn't a very private place a lot of the time, which is good. You know, there are a lot of people there, they're all there to help. But for someone who's in that state of mind and going through that physical experience, having people come in and out and be loud and bright lights and people touching you can be very stressful. And we want to help them feel calm and safe and like they're in a private space. So music can kind of evoke this sense of reverence. So if we're choosing music that is not only calm, but almost, I can't think of the word, but special, right? We can play music that someone's going to enter that room and think, oh, okay, something's happening here. I need to like be calm. They're going to match that. Most people, you know, whatever your environment you're in, the music is usually very carefully selected for however they want the people in the room to interact, right? So the clothing stores at the mall might have like really upbeat music to get you going and get you moving and walking through the store. What we're going to do here, sorry, my cat is running, is create an environment that's calm and feels private so that the people entering in and out will take note of that and be respectful too. So let's talk about safety. Yeah, the feeling of safety through pain relief. So music can actually be a form of pain relief, believe it or not. And this is because of this concept of the gate control theory of pain. So the gate control theory of pain states that only so much stimuli can be processed at one time. So if a lot of the stimuli happening during labor is pain, music can come and compete with that stimuli. So they're experiencing pain, they're experiencing discomfort. If there's also music playing, only so much can be perceived. So they're going to perceive less pain. And it also goes with the ISO principle again, and entrainment in the fact that if they are in training to music that is more calm, they are going to become more calm. If their breathing rate is slower, then their heart rate is going to be lower. So that's really important to know. And following their instincts. We really want to encourage them to listen to their bodies and to feel safe in their body and to allow it to do whatever it needs to do. So we do really prioritize preferred music in this method because music is so personal that having your music, the music that speaks to you, that's important to you, that is special to you, is going to work better. So we're going to really dig into the playlist, so I don't want to talk much about it now, but another thing to know about this is that the playlists are crafted in such a way that they go with each of the different stages of labor. So we can help to create music that if it's active labor and the mother knows that she copes a lot by moving, she wants to pace, she wants to move around, maybe even dance with her partner, we can play music that facilitates that, a dance, you know, music that's in 3, and that's going to encourage them to sway. If the mother is wanting to lay and almost kind of meditate, we can play music to encourage that as well. So we're really just supporting them in what their bodies need to do in the moment. I'm going to let Annie talk about the hormones during labor, because that's kind of what we're aiming for, is to help support this hormonal process that needs to happen for them.
Thanks, Sammy. So you can see here on your screen, there's all kinds of a cocktail of hormones that are happening in your brain during childbirth and labor. So one hormone that you may be familiar with is oxytocin. This is what we typically call our love hormone. And so in active labor, early labor, oxytocin is what is increasing uterine contractions. If you've received the drug Pitocin while you were in labor, this is the man-made form of oxytocin. Music can actually help to increase the flow of oxytocin during labor. So music increases dopamine, like we touched on earlier, which then increases oxytocin in your brain and can help increase uterine contractions and keep labor happening. During the time of birth, we have what's called a positive feedback loop of oxytocin. So the contractions are building, everything is kind of, building upon itself, and the oxytocin helps increase that loop to get you towards the moment of birth. And because music increases oxytocin, it can facilitate that positive feedback loop. Finally, immediately after the baby is born in postpartum, oxytocin levels peak in our mothers and our birthing parents, and music can promote oxytocin to promote family bonding even after the levels have peaked in the mother's body. Really, if you've heard of, kind of being in labor land, having that birth high, this is kind of what we're talking about, that rush and surge of oxytocin that music can help to promote. Another hormone that's really important in birth is beta endorphins. So this is our pain-killing hormone. And like we touched on earlier, music is an audio analgesic. It provides pain relief and distraction. So during labor, your beta endorphins are working to naturally relieve pain, and music can help increase the production of beta endorphins and provide an additional distraction for pain relief. Levels of beta endorphins peak in the birthing parent at the time of birth, and music can continue to provide that pain relief through the moment of birth and into immediate postpartum as the beta endorphins reinforce the breastfeeding. As music therapists working with families, we write specific songs and craft playlists as a therapeutic treatment to help facilitate breastfeeding both immediately after birth and through that postpartum period. Another hormone that is really important during birth is catecholamines. I will call them CAs for the rest of this, so I don't have to say all of those syllables at once. So your CAs are what we call the fight or flight hormones, adrenaline surge. So this is one hormone that we don't want a lot of when you're giving birth. Excess CAs can slow or even halt labor. And this is really important, as Sammy touched on earlier, of creating that safe and private environment. If you feel like you're in danger, if your body is getting those fight or flight messages from your brain, from those CAs, it's going to halt labor, it's going to slow things down. So music actually decreases the flow of CAs in your body. However, you do want a rush of CAs at the moment of birth because this is what triggers the fetal ejection reflex. So by providing that music throughout early and active labor, we can give the body time to slow down the flow of CAs until that moment of birth when they're really needed for that fetal ejection reflex. And then CAs will drop steeply after the birth of the baby. But if CAs continue to flow at a high level after the baby is born, this can actually cause hemorrhaging. So by using music to keep the flow of CAs low, we can actually help prevent hemorrhaging in the immediate postpartum period. And another hormone that's very important in birth is prolactin. So this is what we call our mothering hormone, and this is what facilitates the production of breast milk. So your prolactin levels drop when the cervix is fully dilated. They will increase at the moment of birth, and then after the baby is born is when you want all that good prolactin flowing to be ready to breastfeed. And just like we mentioned earlier, music can help engage the baby so that they're ready to receive all of the breast milk that the mother's body has been producing. The music can keep the baby awake, promote family bonding, and really make for a great first-time breastfeeding experience for the family altogether. And of course, there are many other hormones that are happening during birth, but this is kind of your basic cocktail of everything that's going on. So one of the things we do in addition to our playlist, and kind of like I touched on earlier, we will write songs for parents and babies as part of a music therapy protocol for childbirth. And one of the songs that we write is called a womb song. So a womb song is a song that's created and sung to the child in utero during pregnancy. Now we know that babies as early as 15 weeks gestational age are developing their ears, their auditory systems, and they learn to recognize voices. They learn to recognize accents. So babies with little Southern parents are going to recognize little Southern voices more easily than they would other accents. Babies will also recognize unique melodies and songs. So we will write a custom womb song for the families to use. They can sing it to their baby in utero during pregnancy, and over time the baby will learn not only their parents' voices, but they will learn that unique melody, the song. So after birth, the baby is able to soothe and bond easier with this womb song. And so we can hear an example of a womb song. I've brought one in today for us to sing together. So with our womb songs, we take lots of different musical considerations into account. Young children, babies, especially babies in utero, are still developing. Their brains are still growing, and they can't process a lot of complex information, like very complicated songs with different notes and chords that jump all over the place. So our womb song is really about simple music, simple melodies, simple accompaniment, and words of love and encouragement and affirmation from parents to the baby. So here's an example of a womb song. I love you so, little darling. I love you so. With all my heart, little darling. I love you so. I want you here, little darling. I want you here. Safe in my arms, little darling. Safe in my arms. So there's an example of a womb song that we might use with a family. Now the womb songs are created for each individual family, so they can write in their own words of love or affirmation, or use a melody that's familiar to them, that means something to them. You may have recognized the melody of Lavender's Blue in that song. So for this womb song, we took the familiar lullaby Lavender's Blue and kind of edited the melody so that it would not only be simpler, easier for the baby's growing brain to process, but also simpler and easier for the parents to sing together. Sometimes people think, well, I can't sing to my kids, I'm not a singer. Well, your kids don't want to hear a trained opera singer, they want to hear their parents singing. They want to know their parents' voices and get that from them. So the womb song is about not only giving something that the baby can learn, can help them grow, but also helping the parents instill that confidence and have a bonding opportunity with their child as well. All right, so we do live music like our womb song, but in the labor room, while parents are giving birth, we will typically use playlists of recorded music. This is because A, sometimes it's hard to get a lot of instruments in labor rooms. B, that's not always what people want. And C, by using playlists, parents can really feel empowered and have control over the way that their birthing experience is going. As anyone who has ever given birth before knows, that you can plan all you want, but you can't always control exactly what happens in the outcome. But by using these playlists, you can have more control over the coping skills that you use. You can have more control over how your birth goes. So we have a couple different playlist categories that we work to develop custom playlists for each couple that we work with. Each playlist is normally about an hour long. And like we talked about earlier with entrainment, your heart will entrain to the beat of music. Your breathing rate will entrain to the beat of music. And if the music has, really motion, movement qualities, your body can entrain to things like that too. So these are all kind of specially crafted categories for the parents to use as coping skills or to pair with other coping skills during labor. So let's talk a little bit about what those playlists look like. So one of our first playlist categories is positive focus. So this is mostly for use in early labor, kind of to get you amped up, ready to go. This is more for emotional support as opposed to physical support. So this music can have lyrics, and this is really where we want to incorporate a lot of preferred music for the parents. It kind of builds that positive attitude and sets the tone for how the rest of the labor event is going to go. Another playlist category we will create is a meditation category. So this is really great for any stage of birth when the mother is reclining or maybe in a tub, to be able to use that music to set the space and kind of go inward to meditate as a coping skill. Separate from that, we also have a playlist for relaxation. So like we said, your heart rate, your breathing will entrain to music. And so by playing a familiar, relaxing playlist, you can actually bring down those physical parameters and help your body physically relax. Another playlist category we have is movement. So this is used mostly during the active stage when mothers are anywhere from 4 to 7 centimeters dilated. And this music can support movement in any position. So if you're giving birth without an epidural, you may be able to get up, walk, move around, use a birthing ball, dance with your partner. But even if you're not able to get up and move around off of your bed, you can still incorporate movement as a coping skill, and music can facilitate that. You may be able to roll a birth ball with your hand on the side of the bed. You may be able to move your arms and kind of just do a little dance to yourself, to nod your head, and use that movement in any way that you're able to, and use the music to facilitate that process. Another category of playlist that we use is imagery, which is typically used during the transition stage when the mother is 8 to 10 centimeters dilated and is getting ready to push. So if you think of Fantasia, when you hear music that's telling a story and you can almost picture in your head the little hippos dancing with their tutus and that kind of thing. This is the type of music we use for our imagery playlists. So it's relaxing, but it is intense enough to support the intense feelings, the intense physical experiences that the birthing parents are having. There's a lot of tension and release in the imagery music, and it's meant to support the mother into pushing, which is our last, or not our last, one of our next types of playlist, our breathing baby down or pushing phase. So this is music that is gentle but is still supportive. Probably not going to be very relaxing, depending on who you are. I personally would not enjoy that. So we want to have music that is comforting but still strong enough to support the mother as she pushes her baby, breathes it down. And then once the baby is born, we have birth music played at the moment of birth and that immediate postpartum to celebrate the baby's entrance into the world, to let them know not only through touch from parents, through kind words, but also through music that they're loved, they're wanted, we're so glad they're here. And then immediately after birth, we use bonding music during the first postpartum experience. So this is music that is, again, simpler, not necessarily intense classical music, but stuff that the baby can process, the family can enjoy together, and that keeps the baby alert and awake. So they can get to know their surroundings, explore, breastfeed with their mother, and have that first bonding experience. And then once they've had a good meal, they've met the world, they've made their grand entrance, we can use lullabies, which I'm sure we're all familiar with, so that the baby can go back to sleep, everyone can move into the next phase of rest and recovery, and really just provide that safe, loving, gentle environment.
Just kidding, I'm still muted. Thank you for that. Those playlists are so cool. It's so interesting how they're formulated for like literally the specific dilation. You know, like this is for this time at labor. That's really cool. All right, so music therapy assisted childbirth is ideal for people who want to learn how to use musically effectively in labor and birth, but also desire to have the music therapist there. So in this method, we work with the family. Oh, that's on the next slide. We work with the family and we help. So we're teaching them, but we're also still going to be the person there implementing the playlist most of the time. So this is really great for people who want to use the music therapy, but they don't want the responsibility of having to deal with it on their own, right? We're there as a support person for them. So we help them select the playlist based off their preferences. We help them create them, and we're there with them. So it looks like this. We have 3 prenatal sessions and 1 postnatal session. So the prenatal sessions consist of us explaining the method, establishing the birth plan, helping them select the playlist that they want and helping them create their unique playlists, writing the womb song and the other lullabies, actually doing some labor and birth rehearsals. So in this method, we're actually going to be teaching them some coping skills and when to implement them with the playlist. So it's actually a little bit of education too. And they're given nightly practice sessions. So just like anything else, practicing and is good for committing things to memory and learning it and for it to become automatic. So this method is most effective if the parents really do practice with the playlist, because not only will they not be as frazzled in the moment, they might think that they're good to go, but then in the moment, you don't know what's going to happen. It's a new thing. It's different. So in this method, sorry, I was getting confused by the stuff on the screen. In this method, we're encouraging them to practice. Oh, I can't tell. There we go. We're encouraging them to practice so that they're less frazzled, they feel less overwhelmed in the moment, but also it's creating almost this automatic response. So if they're practicing at nighttime in their own home in bed when they're calm and relaxed with their partner, then when they're in the birth room and things might be a little more hectic, they're going to hear that song and think, oh, this is so nice. This makes you think of being at home in bed and calm. So it's really cool. So then I'm going to talk a little bit about birth music consultation. So we've been talking a lot about music therapy assisted childbirth, where we are there as music therapists helping them. Birth music consultation is very similar and another good option for a lot of people who do not necessarily want the music therapist to attend a birth or can't have the music therapist attend the birth for any reason. So this is great for people who maybe already have a lot of birth support, or maybe they live somewhere really far where they don't have access to a music therapist. There are a lot of different reasons that this method could be really good for people. So it looks just a little bit different. We can do 3 prenatal sessions and 1 postnatal session, or we can do 1 big comprehensive session for them, depending on the people's needs. So this might happen if there's something unexpected that happens later in the pregnancy. So maybe the mother and their partner might be having to live long distance for a while, and she realizes, okay, I need some more help, but I don't have time to do this whole thing. Okay, I'm going to do birth music consultation, because then the music therapist can teach me how to do this, or teach my mom, who's going to be my support person now. And I can still have this even though we didn't prepare early on in the pregnancy for it. So it can be really flexible. We still give them guidance as far as their coping skills and relaxation techniques. Yes, we're still helping them with the techniques to go with the specific playlist, still helping them create the playlist, select them. We're just not going to be there. So typically in this method, it looks even more like education. So we're not only educating the mother, but whoever their support person is going to be there, it's a lot of educating them on how to be the one holding the playlists in their hand, when to use them. So a lot of education for that other person is really important. So we've talked a lot about music therapy and childbirth, but it's important to know all of the benefits of using music when your baby's in utero. So just gonna bust some myths real quick. You don't need to buy fancy headphones to put on the belly. Everything can still be heard down there. They start developing their ears really early, and they're meant to be absorbing the world through that barrier, right? So they're in there, they're safe. Everything's a little muffled, but they still hear it and they still perceive it, because that's what's developmentally appropriate for them. So if a mom is putting headphones on the baby and the dad gets real excited because every time you play Kiss, the baby kicks, it might be the baby being like, it's too loud. So it's important to know that you can still play Kiss on the speakers if you want, get your baby used to that. But ultimately, like Annie said, your baby wants to hear you, wants to hear the parents. So it stimulates brain development. Like Annie said, they start learning language already in the womb. When you're speaking to them, they start to learn speech. It induces a state of calmness, because singing in people actually helps to reduce stress in ourselves. It lowers cortisol levels if you sing. So if that's happening, then the baby is also having those effects from the mom being more calm. And it promotes prenatal bonding, which I'm going to get a little more into that later, but it is important to know that too, that, if someone is feeling disconnected from their baby, singing is a great way to promote bonding. So who may benefit from music therapy-assisted childbirth? Anyone who already uses music as a coping mechanism. So a lot of the guidance that I hear from people who do birth work is that you want to use whatever coping skills you already use a lot of the time. So if you find baths to be relaxing, you might want to utilize the tub. If you find exercise to be relaxing, you might be one pacing around and dancing. If you're someone who likes aromatherapy. So if you're someone who finds that, or if you know someone who finds themselves gravitating toward music as a coping skill, this might be really, really effective for them, because that's already the association they have with music in their brain, right? Is that this is going to help calm me and help me feel in control. This is a great option for someone who either desires to have a non-medicated birth, or for whatever reason can't have certain medications or other procedures. This is a great option because of the pain relieving effect, the calming effect, everything like that. This is also a great option for someone who may need some additional support. So maybe somebody who isn't going to have their birth partner present, or maybe doesn't have other birth support, or someone who has experienced anxiety or trauma. So it's not just the pain associated with birth, but kind of the whole experience that can be really, really intense. So this is a great option for someone who might be particularly anxious about the experience, because this is just another support for them to help normalize the experience and to help them feel calm and in control. And someone who's a musician might be a good choice. I put the asterisk because sometimes as musicians, it's our job or it's our thing, so we tend to overthink it. So it is important to note that just because someone's a musician, this might not be necessarily the best thing for them, because they might be sitting there listening to a piano concerto while they're in labor and thinking, oh, I didn't know there was a fortissimo there, and that's not where their head needs to be. So we really want to get into the implications for music therapy and adoption, because I think it's really exciting. So specifically, some of the positive effects that music therapy assisted childbirth could have with families who are adopting is that it can promote that bonding. So like Annie said, whatever speaking, singing, whatever they're taking in the womb, they're going to learn and remember. So there are possibilities for an adoptive family to record a womb song or a whole CD for the baby, and so that they are starting to get to know them before the baby's even there, and then will still be calmed by that singing once they're born. It's really great for postpartum. The bonding can still happen postpartum through singing, but it's also really good to help establish and reinforce routines. So again, we learn everything through song. So we actually give some education when we do this method to parents on helping to establish routines with singing, with music. So certain singing for feeding time, or certain music for feeding time, certain songs for, okay, we're going to change your diaper now, and certain music for sleep. We can help to make that postpartum period go a little more smooth by giving families tips on how to use music during that time. And music as play to aid in development. So music, again, is starting to be perceived by the time they're, 16 weeks? Is that correct? Yeah. So they are learning these things, and you can help to continue to aid in that development in early childhood by implementing music in meaningful ways. So there are really a lot of opportunities for bonding, and just making that whole experience smoother for everybody, depending on what kind of adoption is happening. I think it's really exciting.
Absolutely.
Yeah.
And I'll tag team on a little bit about, having this as an added coping skill, and especially when you're not going to have as much in-person support. I've seen some really cool ways that music has been used in labor this summer during COVID, where you couldn't necessarily have your partner or have your birth team with you, or your family can't come in to help you with the immediate postpartum period. So some of my families that I worked with, we were able to make custom playlists with the songs that the parents remember listening to and singing to with their families when they were young. So even though the grandparents couldn't be there to greet the baby, they could still, create that, what they consider their sense of family environment, and welcome the baby into their world that way, and to use as an additional coping skill, and pass those family values on, even when everybody couldn't necessarily be present throughout pregnancy or all of childbirth. That's been really cool to see. And we couldn't talk about music therapy in childbirth without talking about NICU babies. So there is specific research with music therapy and NICU babies in particular. So we know from research that music therapy helps babies gain weight faster. It can calm babies who are experiencing withdrawal symptoms. Like we talked about earlier with entrainment, music can actually increase respiratory rate and blood oxygen levels for NICU babies. And babies who receive music therapy in the NICU actually leave the hospital as much as 2 weeks sooner than babies who do not receive music therapy in the NICU, which is super cool. I think it's important to note when we talk about NICU babies, particularly premature babies, that their brains are still developing, that they can't necessarily process the same amount or the same complexity of information as full-term babies. So one thing that we do know from research is that not all music is necessarily appropriate for NICU babies, but also that music can actually be harmful. Babies who listen to more than 4 hours of music a day in the NICU actually show decreasing rates of development. So when we as music therapists go into the NICU, we're working kind of with those, like we demonstrated in the womb song, very simple melodies, simple accompaniments, loving, positive words. So by having that music present, the babies can start to process more complex neurological input. We can then pair that music with a multimodal massage. So if you think about the womb environment, the babies are literally in the fetal position, pushing against the mother's body. They get to learn where their bodies are in space. They get to build those muscles from pushing up against the mother's body. When they're born earlier, they don't necessarily have a chance to develop those neural pathways down their body, or to develop that muscle tone, or to develop that ability to process all of the sensory input of the outside world at one time. So music therapy is one way that we can help them improve their sensory processing, to build those pathways, and to get out of the hospital sooner.
And that's another opportunity to help parents too in the NICU. So a lot of times music therapists in the NICU will help parents to have experiences and create things that their baby can still have while they're gone. So a lot of times, depending on the severity of the situation, the NICU that the baby's in might be really far from the parents and they can't come that often. So music therapists often will create experiences to where they have an opportunity to bond as a family when they do come, or even having the parents record music again to be played for the baby in the NICU since they're not there. So there's other cool options for adopting families too.
Yes, most definitely. So when we look at who might be appropriate specifically for NICU music therapy, we're looking at babies who are probably at least 32 gestational weeks of age. Again, music is a really powerful therapeutic tool, but it can also cause harm if not applied appropriately. And so we want to make sure that babies who are receiving music therapy in the NICU have developed enough of their neural processes that they're going to be able to start from a good place to be able to process that music. Also, babies who are having trouble suckling and feeding can be a great fit for NICU music therapy. If you've been in the NICU, if you've had children, you might recognize what's called a PAL, a pacifier activated lullaby. So this is a pacifier that when the babies suck on it, like use the correct suckling motion, music is played. And that music in itself is enough of a reward to teach the babies like, oh, this is the right thing to do. This is how I properly suck. This is how I properly feed. So that music through the pacifier activated lullaby is reinforcing that feeding mechanism. And that was developed by music therapists at Florida State University. And babies who are struggling with sensory processing too. The environment of the womb, like Sammy said, it's muffled, it's dark, it's warm, it's safe, and babies who leave the womb before being able to fully develop gestationally have a lot of sensory input to learn to process at one time. So by using music therapy, we can start from a really approachable, really motivating place to help them start to integrate all of those sensory processes together. And NICU music therapy is also wonderful for our parents. Like Sammy said, sometimes parents can't be with their babies all the time. And so we can use recordings of parents' voices to have the parents' voices playing for the baby, so they still get that experience of hearing their parents' voices. And especially with adoptive families too, this is really useful. It can be really intimidating to have a baby in the NICU. When they're so small and connected to all of these machines, it can be traumatic for the parents and just scary to know what you can safely do with your child. How do you hold a NICU baby? How do you feed a NICU baby? How can you provide, touch and love and bonding in a way that is safe for that baby? So as NICU music therapists, we can work with the parents to teach them safe ways to interact with their baby, both through music and singing, but also through holding, through a massage that they can do with their babies, even when the music therapists aren't there. For our NICU massages, you typically start from the head and move down, and from the center and move out, because this is the way that your neural pathways develop naturally in the womb. So again, that neuroplasticity, when we're pairing the music with that tactile sensory input, with that proprioceptive input, the babies are actually building those neurons. They're learning where their bodies are, and parents can play a really great role in that. And again, just giving parents confidence that, this is your baby, you are their parent. They want to hear your voice, they want to feel your touch, and that it is safe and a wonderful thing to bond with your baby in that way. So NICU music therapy is another way that we can work with children and with parents throughout the birth and delivery process. So I've realized this whole time we have not asked for any questions. I know Nancy is keeping an eye on the chat. So what questions do we have about music therapy, about music in pregnancy and labor?
We have a couple.
Awesome.
And lots of praise for you guys. So they are loving what you guys have to say. So one, there was a slide that you showed where the music therapist had a mask on. So have you guys noticed with COVID and having to wear a mask as you go into the hospitals or as you are having practice, that this is making a difference? That they're not able to see your face as you all are singing or talking or having therapy sessions with your clients?
That's a great question. I will say that one of the things that we know, at least from COVID research right now, is that singing is a really fabulous way to spread coronavirus. So I personally have not really done a lot of in-person sessions since this has started. Even with masks, we've moved to a lot of online things. I have seen other medical professionals that are still working in person maybe put like buttons of their faces without the mask on so people can kind of have that experience, or the clear face shields can
Yeah.
replicate some of that.
Oh yeah, that's a good idea. So you can
Mhm.
see that. Yeah, I think
Yes.
that would be interesting to know how that affects.
Mm-hmm.
This facial expressions are so important.
Yes, they really.
Yeah, that's
Mhm.
really
Oh,
true. That's an important consideration, especially for those NICU babies. Yeah, they're learning based off of the exaggerated facial expressions, and they don't get that. So, yeah, I think visual aids is a really good idea. Or
Mhm.
oh,
videos, instead of recording just audio, recording a video maybe.
oh, what a great
Uh,
idea. Yeah, I love that. Okay, here's another question for you guys. Do some hospice agencies offer music therapy?
Yes, absolutely. Mhm.
Therapy is I would say pretty common for hospice. I think a lot of hospice facilities or companies really see the value in that, because I feel like I know a good amount of music therapists who work with hospice.
Wonderful. Um,
Mhm.
so this sounds like such a wonderful thing in the birthing rooms for the
Mhm.
mothers.
Mhm.
So why are there hospitals that just this is just part of their service that they offer this, or are there any OBs that say, hey, we do this, this is a service we add on?
I believe that there was one, I don't remember if it was Dr. DeCamillo or somebody she knew, but they had created a program with a hospital to where women could choose that service. Um, I don't think that it's super common, this methodology, but that's a goal of ours, I would venture to say. Annie and I mean, we've reached out to quite a few doula practices
Mm-hmm.
to help kind of try to provide packages with them. But, being in the hospital would be amazing. And um, so it's definitely possible. There are a lot of music therapists who work in hospitals, a lot who have programs in hospitals, but for childbirth specifically, I would say that's a little more rare. Childbirth in the NICU, just because they're such fragile patients, or they can be. Uh,
Okay,
mhm,
Yes. I think it
interesting.
really is on a case by case basis too, with
yeah.
certain hospitals have more coping skills available to parents in general.
Mhm.
So I'm
Right.
hoping that as we, build the amount of coping skills and resources that are available to birthing parents, both in hospital settings and medical settings and otherwise, that it'll
Mhm.
become more common to have it available. Mhm.
Yeah.
Okay. Here is another question. So, how is the best way to find, and is it a certified music therapist or a licensed music therapist?
A board certified music therapist.
Mhm.
Board certified. Okay, so how is the best way to find a board certified music therapist?
Yes. So I think it is cbmt.org, which
Mm.
is the certification board for music therapists.
Mhm.
Will have information for music therapists in all 50 states. So you can look up either in your state and find names of board certified music therapists, or if you're wondering about somebody's credentials, you can look them up there. Um, yeah, I think right now we have over 8,000 board certified music therapists in the States, um,
Okay,
600 or 700 in Texas. Yes.
that's a lot. That's more than what I thought there would be. That's
Yeah,
really
we're growing
interesting.
very rapidly.
Okay, so one other question that has come in is, are there specific methods to access playlists for persons with dementia to
Mm.
listen to at home if their hospice doesn't provide music therapy? What a great question.
hmm
That's a great question. Um, my first thought would be to say preferred music. That's always where I go. A lot of times people ask, like, well, what should I be listening to? What's the best music for this? And it's so personal. And especially with someone with dementia, um, there's still going to be memory associated with music the further back you go. So music that they enjoyed when they were younger is probably going to be well received, because they'll still have an association with it. I would recommend uh, at least probably the first time playing it for them, like having someone around just to see their reaction, just like make sure that there's not negative associations. That's the one thing about music, is it's kind of this double-sided thing. It can be helpful, it can be hurtful. So I would just say to proceed with caution with that, but absolutely it could be a great coping skill. Do you have any other thoughts on that, Annie?
Yes, I know that there are programs that distribute either playlists or iPods or things like that to have music accessible, which is not necessarily music therapy because it's not like in a treatment, but it can still be a great resource to have. I think Music in Memory is the name of one program. Just being sure that, like Sammy said, that there's somebody available to process any emotions or memories or things that come up with that music. But if you know about what time somebody was born, like decade, we know that music from kind of person's childhood into their young early 20s, but then also their parents' childhood and young early 20s, because that is kind of the music that they might have heard growing up their parents playing. Can have some good guesses to start, at least for time periods, if you want to make your own playlists like that.
What a great suggestion. That is so interesting.
Mm-hmm.
So going back to the slides where you showed the different playlists and the different sections that were part of that, I know at the I think the beginning part was where it was individualized. So you were able to use a song where she's able to get up and go and it's her kind of music and everything. Did the rest of those sections, are they all the same for everyone, or is every single section individualized falling into those buckets?
Yes, so we have some that are the same if it works well for you. But again, the big thing is preference. I have created playlists of all of those different types based on somebody's individual music preference. So I created a playlist just this summer that was a lot of Cuban style music for relaxation and imagery for a family whose extended family grandparents could not come in from Cuba to attend the birth this summer. So we do have some set playlists that we start with, but we do work to create those custom playlists based on the preferences of the birthing families with those same parameters. Sammy, do you have anything else to add to that?
Oh, you're muted, Sammy. I think you're unmuted now. Now we can't hear you. Okay, so we'll move on. If you all have any questions, please go ahead and send them. I think we've covered all the questions. So I just kind of wanted to end with a wrap up for things that I learned through this. And Sammy, I think we can now hear you. Did you have something you wanted to say?
No, I think Annie pretty much covered it. Sorry, I don't know what happened with my mic.
That's okay. It's technology, as we all know and love it.
Yes.
You guys were just so wonderful, and it was great to hear again, because I always forget that music is processed in every part of our brain. I think that's so important to remember and to know. And the concept of entrainment is just fascinating to me. And I guess I need to pay more attention, because when I just haven't been shopping during COVID, but when they play that music, and I know that there's a secret sauce on what they're playing in order to get you to purchase more, and so that your body moves in time to that. So that was interesting. And then the cognitive, it's the memory and the learning of that. Have you guys that's so funny, for when to spell baloney. And I'm probably aging myself, but the Oscar Mayer song, you know, Oscar Mayer has a way with B-O-L-O-G-N-A. So
Yep.
I can never, ever spell baloney without singing that song. And it's just ingrained in my memory. So I love that part of it. That's just so cool to me. And then Annie, the womb song makes me cry every time I hear you sing it. It is so powerful. And I was watching Sammy as you were singing, and she's swaying back and forth. And both she and I have these big grins on our face. There's something about that. And so I can just imagine for the baby what
Mhm.
that does. And that must be so rewarding for you guys to be able to create those with the family. This just blows my mind how you do that. And I loved how you incorporated music and adoption, because that is so important to Gladney clients and
Yeah.
having that bonding and that attachment.
Mm.
And so, you know, us sharing that message, and hopefully we have some adoptive parents online that are encouraged by that. I think that's super fantastic. So if we, let's see, I think Jess has got some polls. Jess, I added some polls if you want to open them. Okay. So I'm going to do a poll here. If anybody has any other questions, please, if you guys wouldn't mind filling out this poll for me, and we'll close it in just a second. But if you have any questions, please let us know. We have many, many trainings this month in October. So you can go to gladneyuniversity.org to find out what those trainings are, and to register for those. All of those are free. They're all virtual, and we're really excited to be able to offer our community these. We have people from Australia, United Kingdom, and Canada that attend these trainings, which is really cool. And then, of course, our great state of Texas has the most people. So we absolutely love that. Annie and Sammy, can you all share with us one more time how, if we wanted to get with one of you guys to do music therapy, or to have a playlist created for us, how do we do that? How do we connect with you? And let me go ahead and close out this poll so that we can see you. Hold on one second, and I'll close the poll so we can see you again.
Yes, definitely. So our website is heartandharmony.com for our music therapy practice. We're also on Facebook and Instagram and Pinterest as Heart and Harmony. My email is Annie@Heart and Harmony. Sammy's is Sammy@Heart and Harmony. If y'all have any questions about anything, really, would love to talk to you, connect with you,
Okay.
hear your thoughts.
All right.
Yeah.
One more question has come in from you guys. I'm sorry, Sammy. Go
That's
ahead.
okay. Oh, I was just going to say, yeah, all of our contact and just so much information is on the Heart and Harmony website. We also have a blog, which if you're interested in that kind of thing, it'd be great to follow. But yeah, so our contact info is on there. Same with our founder and a lot of other music therapists on our team too that have different specialties. So definitely check out the website.
Okay, and you all serve all of the Dallas-Fort Worth area, is that correct?
Yeah.
Basically? Okay. All right, so our last question that we have before we end this wonderful training is, how long does it take for you guys I know, Annie, you mentioned creating one playlist this summer. How long does that take for you to create one?
Longer than you'd think. Yeah, so part of what goes into creating a playlist is not just the type of music, but things like the tempo, the volume, how the songs flow into another song. So Sammy may be more efficient than I am at this. I've found that when I create hour-long or so playlists, it'll normally take me 2 hours, 3 hours, because you really want to make sure that the music as it's playing is unobtrusive, is pleasant, that there's nothing, a surprise vocal that's going to pop up 1 minute and 47 seconds in that's going to throw somebody off, and to really match all of those parameters and match the energy. I don't know what Sammy's process is like. She may be quicker than I am at that.
No, I would say that's accurate. I mean, it's easy the very beginning. You're like, ooh, this song could work, this song could work, this song could work. And then you go back, you have 3 hours worth of music that you need to narrow down and make work in a meaningful way. So it definitely does take a little bit longer than just like making a mixtape. But it's very fun work. I will say that. I love it.
Wonderful. Well, we appreciate all of your hard effort and all of the hours that you put into that. And thank you guys so much for once again providing such wonderful information for us. Y'all are just the absolute best. So thank you very much. And we will see you hopefully again and invite you back anytime that you guys want to come and share. And thank you guys for attending, our audience. Thank you for attending another Gladney University training. And once again, when I end this webinar, a pop-up will come with your CEU evaluations. If you'll fill that out within 7 business days, you'll get your certificate. So thanks a lot. Thanks, Annie. Thanks, Sammy. We really appreciate you all so very much. Y'all have a great day.
Thank you. You too.
All righty. Bye-bye.